Good morning, everyone. Thank you so much for joining us today. My name is Joy Daly. I'm excited to be here with you on behalf of SUAA to lead this educational seminar on Medicare. I'm joined today by my colleague, Mr. Zach Ma, and together we will be guiding you through the key information to help you better understand your Medicare options and to make confident, informed decisions. In addition to Medicare, we are also passionate about helping people find financial protection for retirement income, life insurance, and long-term care planning, something very close to my heart. There are vital pieces to the retirement puzzle, and we're here to support you every step of the way. And we look forward to a great session and welcome all your questions at the end of the presentation for a Q&A. This is Medicare Made Simple with Key Retirement Solutions. We're going to go over the A, B, C, D parts of Medicare. What is Medicare? Medicare is a federal health insurance program for people over the age of 65 or turning 65, or people who are under the age of 65 who are disabled. Medicare is funded by the Social Security Administration, i.e. the taxpayers.
And there's your red, white, and blue card.
We all pay 1.45% of our earnings into FICA, Federal Insurance Contributions Act, which goes toward Medicare. Employers pay another 1.45%, bringing the total to 2.9%. If you're self-employed, you must cough up the entire 2.9%. As long as you have paid your taxes for 40 quarters, which is basically 10 years, you qualify for Medicare benefits. Thank you. The four parts of Medicare, A, B, C, and D. With Medicare, you have options to how you get your coverage. Once you enroll, you'll need to decide if you'll get your Medicare coverage two different ways. There are two main routes that you could take: Medicare versus Medicaid. Most people get these things confused and use the very wrong terminology. Medicare is the federal health insurance offered to people over the age of 65 or people under the age of 65, again, who are disabled. Medicaid is an insurance through the state aid that is offered to anyone who meets low income limits. You can have Medicaid at any age. Some people have both Medicare and Medicaid, referred to as Medi-Medi. Thank you. So Part A of Medicare is hospitalization. Part B is your doctors. Part C is called a Medicare Advantage plan. And Part D is prescription drug coverage. You can have one or the other. One would be A, B, and Part D, which is your prescription drug plan, or a Part C, which is called a Medicare Advantage plan. So the first part is called Original Medicare. An Advantage plan some people refer to as Medicare Takeover Plan. Both provide the prescription drug coverage. The first part, Original Medicare, has the Part D, which is a standalone plan, and an Advantage plan includes the prescription coverage within the plan. It's kind of a all-in-one health plan instead of having a la carte where everything is its own additional piece. So that is Original Medicare, where you basically have no network. You can go anywhere in the United States, or a Medicare Advantage plan, which is a very big network. It comes HMO or PPO, but it is networked. It's the
Joy,
overall.
let me interrupt real quick. Zach, I think you've got the PowerPoint slide up there. Could you zoom in a bit? I know some of our
Yeah,
members are saying that the type is a bit small and they're just struggling to read some of it. So
absolutely.
I know it's a struggle to keep as much of the PowerPoint slide in picture while zooming in, but I'm sure they'll appreciate now. Yes, it's obviously now much easier to read. So sorry to interrupt. Joy, I'll let you get back to it.
No,
No,
thank you.
thank you. Thank you. So basically, yeah, your original Medicare, you have no network. You can go anywhere within the United States, any doctor, hospital, or facility that accepts Medicare, you're golden. Medicare Advantage plans, there are PPO plans that are very, very, very big networks, but they are still networked. If you want to move on, Zach, I didn't want to get too into the weeds on that. It's
Yep.
just an overall.
Okay, I'll zoom out a little bit. Go back into here.
So when you're on original Medicare, you want to have a supplemental plan. Original Medicare picks up 80% of the cost once you have met a deductible. The deductible for 2025 is $257, which will be going up in 2026 to $288. Once you've met that deductible out of your pocket, the supplemental plan, which the most popular plan is plan letter G, that picks up the 20% that Medicare has left behind. Now, all these plan letters that you see are standardized plans. They are exactly the same, no matter which insurance company you get them from. The only difference between one company to another would be how much you're paying for the coverage of plan letter G or another letter that you choose. But by far, plan letter G is the most popular plan.
Mm-hmm. And then just to add on to that as well, too, not every single plan letter is offered in every single state as well. The most popular ones here in Illinois are going to be G, N, and then even some K plans as well. Okay.
So Medicare premiums and IRMA. Part A Medicare premium, for most people, some people consider it, or it's called the free part. Is it free? Well, you had to have worked basically 10 years, which is 40 quarters, to be eligible to receive Part A of Medicare at zero cost. Part B of Medicare is income-based. Part B of Medicare has a premium. So Medicare looks at 2 years prior AGI to determine your Medicare premium. In some cases, you may be charged IRMA, IRMAA. If you will move forward, please.
Yep.
Thank you. What is IRMA? Income-related monthly adjustment amount. This additional charge is tacked on to your Part B of Medicare and the Part D premium. There are ways to appeal, especially due to life-changing events like retiring, work reduction, divorce, those kind of special things. Importance of incorporating this into your financial plan, as withdrawals from certain accounts can affect your income bracket. If you start taking income from an investment, that is going to add on to your annual income, taxable income, thus changing your Medicare premium. So the more you pull in annually, here's a chart to give a general overall where you may fall in a Medicare premium. So if you're married filing jointly and the income is less than $212,000, your Medicare premium is the base $185 for 2025. In 2026, that is going to $206.50. So then if you are in the next income bracket, that 185 moves to 259 monthly, 370, 444, 591, and 628. The government is always going to look back 2 years. So moving forward, once your income drops down, if it does, so will your Part B premium, and the Part D IRMA adjustment will drop off after 2 years once your income drops down, if it does. Thank
Yeah, and
you.
I would always just add into there as well too. It's very easy for the government to find out what your income is and what IRMA bracket you will fall into, and they will send you a notice letting you know what your IRMA charge is going to be. But when it comes to if there has been a reduction in your income and now maybe you're going to be charged less for your IRMA, I would always recommend to contact Medicare to make sure that they are seeing that change. It's for some reason with the government, it's always difficult to get the prices to go down rather than going up. So always just make sure you're in constant communication with reducing that Part B IRMA. Keep on further.
So yeah, you could keep going further. How do I know what information is credible? It can be challenging to know who to trust and all the misinformation or noise out there on Medicare. Getting the information from a credible, trustworthy source is essential. Look for logos on mailings as seen below to help identify legitimate communications. Many agents and call centers are focused on selling, not educating. Work with a trusted advisor who focuses on education and has your best interest in mind. There is no best plan for everyone. Your Medicare choices should reflect your unique individual need and circumstances.
Joy, excuse me, real quick. One of our members wanted to know, what does IRMA stand for?
Sure, Zach, if you could back up on there.
Yeah.
Income related monthly adjustment amount.
If you're retired, are you charged at IRMA?
It's based on your annual taxable income.
Yep. So let's say you got onto Medicare at the beginning of 2026. They will look at your income based on 2024.
So the Medicare market is evolving. The Medicare market has changed significantly over the past 5 years and continues to evolve every year. It is essential to get your information from a licensed, up-to-date, credible resource. We are required to recertify every year and pass examinations to stay accredited and knowledgeable about upcoming changes. I'll tell you this, Zach Ma is the most educated and informed person that I know. I've been doing this 15 years and I still have questions. I go to him very often with new things that come up all the time because not everyone's individual situation is the same. So there's always questions that come up. As the market shifts, there are many new plans that are more cost effective or better to fit for your needs. As your life and situations change, your coverage should evolve also. Thank you, Zach.
Thank you, Joy.
Why annual Medicare plans every year can save you hundreds, even thousands of dollars. It's becoming increasingly important to review and analyze your coverage each year. The days of set it and forget it are definitely over. The plans, the cost, and the benefits change from year to year. It can feel overwhelming, but with a trusted specialist by your side, you'll be guided through each step with clarity and confidence. Our goal as your specialist is to ensure the necessary updates and handle smoothly and easily. Thank you. So, important Medicare timelines and enrollment periods. Your initial enrollment period, that's when you're turning 65. It begins 3 months before the month you turn 65, the month that you turn 65, your birthday month, and 3 months after the month you turn 65 is an IEP, initial enrollment period. Another enrollment period is coming up right now, October 15th through December 7th. This is called your AEP, your annual enrollment period, your annual election period. During AEP, anyone on Medicare can switch from original Medicare to a Medicare Advantage plan. You can switch from an Advantage plan back to original Medicare, change from one Medicare Advantage plan to another, join a Medicare drug plan, switch your Medicare drug plan. These changes are made during the AEP and take effect on January 1st of the following year.
Yeah, and then I just want to interject one thing here as it will pertain to USAA members, specifically for your trail plans or your trip plans. I believe your enrollment period, as far as when you need to make decisions to either stay onto that plan or new people getting onto that plan, I believe is from October 15th to November 15th. And I got that straight from the website for you guys. So just always make sure that you guys are taking care of that as soon as October 15th rolls around. So if you do want to make any changes and want to look at anything else, you can.
Important Medicare timelines, enrollment periods. Medicare Advantage plans for individuals not on trip or trail. The open enrollment period is January 1st through March 31st. During this time, those who are already enrolled on a Medicare Advantage plan can switch to a different Medicare Advantage plan or return to original Medicare. The special enrollment periods, an SEP, allows you to enroll in or make changes to your Medicare coverage outside those regular enrollment periods due to specific life events or situations like retiring, losing other healthcare coverage, leaving an employer's group plan if you're moving, or qualifying for certain assistance programs like Medicaid. Medicare versus your employer plan. Many people don't realize you can enroll into Medicare while continuing to work without starting Social Security benefits. It's important to compare these benefits and cost from your employer to Medicare coverage. Don't assume your employer coverage is automatically better than Medicare. Often Medicare plans can be more affordable and better coverage than employer plans. Medicare gets a bad rap, and it's really pretty great insurance. Once you turn 65, you can leave employer plans and switch to Medicare at any time. No need to wait for an enrollment period. That would be called your SEP. The importance of personalization. There is no one-size-fits-all Medicare situation. Everyone's needs and preferences are different. If you talk to 10 different people, you'll hear 10 different opinions. What works for one person may not work or be right for another person. Medicare can overwhelm you with generic information. We will break it down, simplify it, and tailor it to what's important to you. Our philosophy is that we get to know you, your health needs, and your personal preferences. We work backwards to find the best plan on the market that fits you. simply the information to empower you and to make a decision that you feel is comfortable and one that gives you peace of mind. We're here for you. Our services are always free. Supporting you in enrolling into Medicare or reviewing your current plan, trustworthy guidance to help you feel informed and empowered about your insurance, a small family-owned business that treats you like family. We do what's right always. You're not just a number. We're here to build lifelong relationships, be by your side every year as life and Medicare evolves.
Okay.
Together, we find the fit for a Medicare plan that fits your life and supports you, that you can trust every step of the way. Reach out for your free consultation, one-on-one, individualized to you. We don't just offer Medicare, we offer other plans like cancer policies, critical illness, home health care, standalone dental plans, and once again, long-term care that is very passionate to me and close to my heart. All right, so if we want to open the forum to some Q&A, Zach and I are here to do our best to answer your questions.
Yeah, and
yes. I'm sorry, go ahead, Zach.
yeah, I just wanted to add in as well too. So, that was just a general overview of Medicare for you guys, and certainly we want to be able to answer the questions that are more specific to you as well. In-person meetings are usually the best way that we work. We can also do video calls as well too. But so for anyone that's on a trail or a trip plan, those are considered Medicare Advantage plans. They're sponsored by the state and the colleges, but they, at the end of the day, they are still all Medicare Advantage plans. So the fact that they are employer sponsored means that they are different than what anybody else that's on Medicare is able to get. So everybody that's on a trail or a trip plan has specialized benefits that not everybody has access to. And so those we find are, tend to be very, very good plans. But as Joy mentioned, it is always, person to person as far as how you want your insurance to work for you, what the type of freedoms that you'd like to have. And then also too, just kind of going through the numbers to make sure that, your insurance is working for you exactly as you want it. So we do have all of the information on the CIP plans, the trail plans, the trip plans as well. So if you have any questions on those benefits, we can answer them. But I just wanted to make that distinction that those plans are indeed Medicare Advantage plans and they function as such. So, as with everything, they don't cover everything, and that goes into Joy's comment with long-term care, but it also there are some few gaps as far as co-payments that we are able to help out with as well too. So
Patricia asks, if we retire and then apply for parts B and D, is the charge initially based on the 2 years prior to retirement?
Yes. Yeah, for the IRMA charge, yes. They'll always look 2 years back. But going to what was on the slide is if there's a significant change in your income, maybe you're earning significantly less than when you were working, that could be a potential to get waived from that IRMA charge. There is a form that you can fill out and send it into Medicare, and they may be able to waive that IRMA charge.
And Laura says, to clarify, a premium is a monthly charge and a deductible is an annual charge before coverage applies, correct?
On original Medicare, that is correct. If you are on a Medicare Advantage plan, there, in most cases, is no deductible.
Another member asks, right now, the state picks up my health insurance When I turn 65, does the state pick up any of the Medicare cost?
Not that I'm aware of, no.
No, but I do know that if, depending on how many years that you have contributed, to where you're working, you may have a premium-free trail plan. And so if you've worked over 20 years, then I believe that that is free to have the plan, but the Medicare premiums you would still have to pay. And I'm not sure if we went over this either, but if you are not taking Social Security, then those Medicare Part B premiums will be directly mailed to you for 3 months. All right, they'll charge you every quarter for that. And then if you are taking your Social Security when you decide to get on Medicare, that will come straight off the top of your Social Security check before you even receive it.
This member says, my monthly adjustment is being based on my tax form, but that amount reflects both my salary and my wife's salary. I am retired. She is not. How can I get the system to just use my salary as the base for payment?
That's a great question.
No, it goes by household income. So as long as you're married, filing jointly, they're looking at the household income.
Do you have to apply for Medicare at 65 if you are still working until you're 70?
I would recommend taking your Part A of Medicare, turning 65. But if you are going to continue to work and stay on an employer's coverage, you would waive your Part B like boy until you decide to go on to Medicare primarily.
Mm-hmm. And if you're going to go on to the trail plans, because those are Medicare plans, you would need to take your Part B to be able to get enrolled into those plans.
What is the IRMA premium for those married, for those filing jointly?
So that is on the presentation chart, which you'll be sending out. So it's all income based. But Zach, if you want to.
Yeah, I'm looking at it right now, and it really depends on what the income is, whether you're single or married. Those are different amounts. But what I can tell you, just to make it a little bit easier, is if you were married filing jointly and as a household you are earning less than $212,000, then you will not be charged an IRMA penalty or charge.
Excuse me, I was muted there for a second. So this is getting more, I think, in terms of key retirement solutions. Mark asks, in terms of financial services, are you a fee-only advisor? How are you compensated for your services?
Great question. Yeah, so myself, and Joy, we are strictly insurance brokers. And so we do not have our securities licenses to do any trades or anything like that. However, we do have a fiduciary in our office. Actually, we have 3 fiduciaries in our office who are Series 65 certified. And so there are some in the Bloomington area, and then we also have some that are down in Peoria as well too. Right over there. So that's Stephanie Burling, Caleb Graybeal, and Kevin Pummel. And so they have their own fees. I want to say that they're relatively low. I'm not 100%, don't want to speak for them, but me and Joy, our services are free. And so if we were able to help you out with any policies, we get compensated directly by the carriers.
Zach, were you saying that team in Bloomington, is that also Key Retirement Solutions?
Yep.
Okay, so just for our members know, if you go to krs.insure, that's the website, correct?
Correct.
At the top of the screen, there should be a tab that'll say about, and then I know there's like a meet our team in Illinois, or there's something with you guys in Geneva. Would they be able to find that team in Bloomington off that website?
Absolutely, yeah. Yeah, it should be about, and then I believe that they are also included in the Geneva team on the website because of management management rules and everything like that. So, but yeah, they are based down there in Bloomington to make it a little bit easier to get out to you.
All right, getting back to the questions, if you move out of state, are the trip and trail plans still available?
So that's a great question. I would say that you're able to keep the plan should you decide to do so, because I know those plans are PPOs. However, what I would say is that you would want to contact Aetna to check to see if that network extends to out of state. Because it's possible that with PPO plans, you're able to have coverage anywhere you go, but generally, if you go outside the network, costs increase. So with those trail specific plans, I would contact Aetna directly, say, hey, I'm looking to move to this state, and is my network also going to be included out there? There are some companies that will say, if we are in another state than where you currently live, and you decide to go out there, whether it be for vacation or you're moving, and you're still going to a hospital that is in network with the company in general, then they can extend those in-network rates as well too. But when it comes to the trail specific plans, that's where I would recommend to contact Aetna directly, just to double check, because I would say typically you would want to find a new plan wherever you're moving.
I'm 81 and still a full-time employee. I have Medicare Part B. I am retiring on June 30th. What do I need to enroll in? I would say, I guess that's a personal choice.
Yeah, I kind of missed the beginning of the question. Sorry.
Well, she was saying she's 81. She's a full-time employee. She has Medicare Part B as in boy. So she's retiring on June 30th. So then she was asking, what do I need to enroll in?
Gotcha. Yeah, so if she's not currently enrolled in another plan and she just has A and B and group insurance, and she's losing her group coverage, then I would say she would need to look at either a trail plan if that's offered, a supplemental plan, or a regular Medicare Advantage plan that she can get just on the market. So that would be kind of, like you said, a little bit more personalized answer.
Do you two happen to know? I mean, I know we have many of our members who live out of state. They are on the trail plan. Sandy asks that, although she works in Illinois, she lives in Indiana. Are there providers in Indiana under the trail plan? I would have to think they would take trail in Indiana as well. Joy or Zach, do you have anything to add?
Yeah, I would.
They do. It may be networked for certain doctors, but obviously it does travel with you.
Yeah, it's still a PPO. You still have coverage even if they're not in the network. I mean, I have some clients that are on the trail plans in Illinois, and there are even some doctors in Illinois that do not accept of that trail plan. So again, that would be a conversation to talk with Aetna, let them know the specific provider that you are looking to see, and see if they're in network or not. Because you can go to them, but if they're outside the network, the cost will generally be higher.
Can you review the open enrollment timeline approaching your 65th birthday?
Sure. So that is called an initial enrollment period, IEP. So you would want to start putting wheels in motion for your plan choices 3 months before. You have the month of and 3 months after.
Yep. So long as you choose some sort of plan within those months that Joy just mentioned, then you will not be receiving any sort of penalties for Part B or Part D.
Karen asks, can doctors and medical centers reject Aetna's PPO Medicare Advantage plan?
They can choose not to be in network with the plan, but because it is a PPO plan, they can't refuse service to you if that's the question. They will just charge you what the out-of-network price would be.
John Marlin, good to hear from you again. He asks, or he says, there is discussion at the federal level of having Medicare cover new weight loss drugs that cost around $1,000 per month. Given that millions of people might want these, What are the implications for the monthly IRMA type charges for retirees on Medicare and Medicare Advantage?
Yeah, so that's kind of a two-part answer there. So the IRMA charges will be basically added to both Part B premiums and also the Part D, as in dog, premiums as well. So if you are on a Medicare Advantage plan that has, neither a premium for the prescriptions or premium for the plan, but you do qualify for those IRMA, charges, then you can still expect to see those on a $0 plan. So if you're getting the first tier of IRMA, which adds $74 to your Part B and $13.70 to the Part D, then that is what you will then pay in premiums to have that coverage. Now, in relation to the expensive prescriptions, it will come down to what the prescription coverage is for your specific plan. Medicare Advantage plans typically come with that coverage included. And so you actually, I think I sent it to Thomas and Brian, and maybe we can send this out to the members as well too. But if you are on a trail plan or a trip plan, there is explanations as far as the tiers of medications and what that cost sharing will be. But as a whole and a general rule, Medicare and all Medicare plans in 2025 have a $2,000 maximum. So nobody on any Medicare Advantage plan will spend more than $2,000 for medications out of pocket. Next year, that will go up to about $100 to $2,100. Go ahead, Joy.
That's on covered medications.
Correct.
So if the medication's not covered by the insurance company, it could be well over $2,000.
Yep, it's got to be included onto the company formulary. Exactly.
Jim is saying, if I do not have enough Medicare quarters and my wife is under 62, does the state still cover my health insurance? And does she have to be 62 for me to be eligible, or is it the year she's turned 62? I'm assuming that's related to being eligible for Medicare.
So to be eligible for Medicare, you have to be turning 65 or be on disability for 2 years under the age of 65 before you're eligible for Medicare. Now, 62 is the earliest you can collect Social Security benefits, if that's what he's referring to.
Yeah, well, and I'll add in there too, because there is that spousal benefit as well. So if she's 62 but has worked and paid into Medicare for more than the 40 quarters, then I believe you would still be able to receive those spousal benefits if you are 65 and eligible for Medicare.
This is going back to something Joy talked about earlier. So Laurel asks, would you also waive Part D if working and employer paid insurance? I think Joy suggested taking Part A, but waiving Part B until leaving the employer plan.
That's something that's an individual choice. Sometimes Medicare can be a better option. It could be more cost efficient or better medical coverage. So you always want to compare a group plan to a Medicare plan when you have the option to go on to Medicare. So if you're going to continue to work and your benefits at the employer are equal to or better than Medicare, you would stay with your group plan.
Mm-hmm.
Therefore, waiving the Part B like boy and Part D for drugs.
Gina asks, as I understand it, SURS/CMS requires that the retired dependent, in parentheses, my spouse, take Part B, even though I am working and paying for his insurance. Is that true?
That is strictly decided by the employer. So if it is going to be a Medicare plan, then in order to, and that's a Medicare Advantage plan through the employer, then you would need A and B to be able to be enrolled into that plan.
That's correct.
Laurel says, I pay into SERS, which includes a health coverage for retirees. How does that affect my Medicare benefits or vice versa? Who is primary, and do I choose Part A, B, and D?
Yeah, if you are, I think she's talking about a stipend or maybe an allowance that she gets towards her that she can use for medical benefits. If I'm understanding that correctly. And so basically any costs that go like co-payments or sometimes even premiums as well too, you can use that stipend or allowance from the SURS to help pay for co-payments or prescription costs and things like that. What was the second part, Thomas, of that question?
Well, it didn't have a question mark, but so we went over how does that affect my Medicare benefits or vice versa? It ends with who is primary,
Yes.
and do I choose Part A, B, and D? No question mark there. It just says, and do I choose Part A, B, and D?
Yep. So with the trail plans or the trip plans, the primary would be Aetna, because any Medicare Advantage plan in general, they are taking over the reins. They have the keys to the car for your plan. If you have, and you need to have A and B to enroll in a Part C Medicare Advantage plan. You do not need to enroll in Part D because that comes included with those trail plans.
And we've discussed a lot about trail. We've discussed some trip. I think the vast majority of our members are most likely on trail. But Donna is asking if the two of you could clarify what the trail plans are.
Yeah, they are Medicare Advantage plans that are offered by the company Aetna, and they basically are in an agreement with the state to offer this plan to their employees. And so these are plans that only state employees are able to have access to. And depending on how long you have worked for the state and how many years you put in, that may affect what your premium for the plan is. But they are complete coverage. It is a Part C Medicare Advantage plan that has prescription coverage included.
Eric wants to know, when traveling on vacation, are we covered, or are there steps we must take to check for network coverage in advance?
Usually when you're traveling, if it's a true emergency, you are treated as if you are in network in a true emergency anywhere in the United States. God forbid you're in a horrific car accident or have a heart attack, stroke, true emergency. However, if you are outside of U.S. territory, you have no Medicare, and those trip, trail, any Medicare plan is no good outside of U.S. territory. So if you're on Medicare and you are going to travel outside of the U.S., I always recommend getting travel insurance, which is very, very affordable. It's very inexpensive, but something I highly recommend.
Vicki would like some clarification. She asks, your recommendation is to enroll in Part A and waive Part B during your IEP.
If you are going to continue to work with group coverage that is equal to or better than Medicare's guidelines. So in order to decide what's better, that's what Zachary and I are here for, to compare what you have to Medicare and see what the best option is for your individual need.
Joe Gibson's just putting it out there that there is always a Medicare premium for Part B. If there's
Correct.
no disagreement. Okay. Always a Medicare premium for Part B. Peter's got a little longer question here, so just bear with me as I get through this. He's saying most PPO Medicare Advantage plans have tiers that increase out-of-pocket costs when you see a particular specialist or hospital. For example, a neurosurgeon can charge more than a rheumatologist. Since some physicians and hospital providers don't accept Trail within Illinois, how can Trail enrollees find out which providers are out of network and which tier a provider is in without having to contact Aetna?
So yeah, if you don't want to contact Aetna, then you should be able to access a customer portal on the Aetna website. And there should be a option for you to search for providers if you don't want to call in on the phone.
Missy says, to recap, original Medicare has a $257 deductible currently, whereas Trail Medicare Advantage will have a $0 deductible.
Most Advantage plans do not have a deductible. You go straight to co-pays for services.
Yeah, and I'll double check here. So for 2025, the Trail plan has a medical deductible of $110.
Thank you, Zach.
And that doesn't mean the first time you go to the doctor, you have to pay $110. If you get a test done and it's only $50 for that test, then you pay $50 for the test, and you have $60 left to pay for the rest of that deductible.
Donna is saying she works for CLC Community College in Illinois. She is in CSRS. She's saying that CSRS advised us Bob, I'm assuming her spouse, does not need Medicare Part B while he is covered under my employer insurance company. Your answer may be different. She's addressing this to me. Ask KRS. When I retire, both Bob and I must get Part B as a requirement of getting on the Trail Medicare Advantage plan through Aetna.
Yes.
Any Medicare plan that's offered through Trail, TRIP, CSRS, independently, any Medicare plan, you must be enrolled in Part B like boy.
Mm-hmm. And if they offer like a retiree plan, that is a group retiree plan, that is not a Medicare plan, then I would just advise to take a look at that and the costs that come along with it and compare it with Medicare, because generally Medicare will have lower costs in most cases.
John Marlin had earlier asked about weight loss drugs and how that could potentially increase costs. Now he's clarifying. He goes, my question is in relation to increases in the IRMA premium, not individual coverage if weight loss drugs are covered. So I guess with an increase, let's say if weight loss drugs are now, included and covered by Medicare, would that have an increase in the IRMA premium?
Yeah, I understand. So it will not affect IRMA specifically because that is solely dictated on your income, in the previous 2 years. So as far as it relates to IRMA, that is set by the government, and they do not take the prescription cost into account as far as what those charges are going to be. Now, it does, however, affect the premiums of standalone prescription drug plans. If you have not a Medicare Advantage plan and you have A, B, and Part D as in dog with a supplement behind it, that standalone prescription drug plan generally does have a premium attached to it as well. And so what we are noticing for both this year and next year is that those premiums are starting to increase due to the increased coverage of those more expensive medications.
How do Medicare premiums get paid? Do they come from our pension checks or do we pay Social Security directly? Wasn't quite sure what that meant about Social Security. Go ahead, Joe. Sorry.
Yeah, it's an option. You can decide whether you want it taken out of a Social Security check or be billed directly or taken directly out of a account, whether it's a bank account or a credit union account, as long as there's the routing or banking information, it can be deducted from there.
Yeah, and that's specifically for the Part B premium. If you're only been working for the state for less than 20 years, then there may be a premium for your trail plan as well, and that is, I believe you do have the option to have that come out of your pension from CSRS, or you can choose a different payment option as well.
Donna, I'm going to go ahead and answer your question. The full name of Trail is Total Retiree Advantage Illinois. So if you want to talk, if somebody's, if they take Trail, it's Total Retiree Advantage Illinois. Patricia wants to know, please explain what Part G is.
So Plan G is secondary insurance to original Medicare. So they've done a very good job of making it confusing, but hopefully I can simplify it for you. If the word part is before the letter, Part A, Part B, Part C, Part D, those are government plans, Medicare plans. So a Plan G, like George, is a private plan picking up the 20% that Medicare has left behind after you've paid your deductible of $257 for the 2025 calendar year. I hope that clears it up.
Yeah, and then I'll just tag on to that as well too. The Medicare supplement, or also known as Medigap policies, which are those Plan Gs, it is strictly just health coverage. It does not have any prescription coverage or anything like that.
Is it true that if I leave Trail, I cannot rejoin it another year?
I have worked with clients who were told that, but then in years past, they have made special enrollment periods where if you did leave Trip or Trail and you wanted to go back, they were making special exceptions within that year for those individuals to come back to those plans that are offered. But the general rule is if you do not take the plan, it's gone.
This member says, my husband is over 65 and my son has a disability and both have Medicare. When I turn 65 in December of 2026, do I have to switch to Medicare or can I stay with my SURS health insurance? I am retired from a state university.
It's an option. I would compare it, but most definitely, if CSRS is the better option for you, then you can keep that coverage.
Yes, so long as they allow you to. I think the general rule is that companies have to at least offer you that coverage still. But I think they designed the plans to make it so that way it's more advantageous to go on to the Trail plan.
David asks, does a state of Illinois retiree have to take the Trail insurance or can they elect just A and B? If I have 20 years of service, does that cover any of the premium for either insurance?
Go ahead, Sam.
Yeah, so you can decide to go with just A and B if you'd like, but there are a lot of costs that come along with that. And so we would always recommend to have some sort of secondary, whether it be a supplemental plan or a different advantage plan that's available to everybody in the market. But when it comes to Trail and that you've been working there for 20 years, I believe that your premium for the Trail plan should be at no cost to you. Just to clarify too, in pretty much every scenario that I would run into somebody who's on A and B, I would not recommend anyone only be on just Medicare Part A, Medicare Part B, and a standalone drug plan, I would always recommend to have secondary coverage in place with that as well.
I'm going to kind of take the lead on this one just to give some inside baseball information to Diane, and then we'll see if Joy and Zach, if you have anything to add. So Diane had asked, can one purchase a separate dental or vision plan that is better or pays more timely than what is offered through the trail plan? So Diane, I'll just let you know that SUAA recently partnered with a company called AMBA, AMBA, and we do now have a dental and vision supplement plan that is available. You may have even received a letter in the mail about that. And if you have more questions, you can always email me, thomas@suaa.org, or call, excuse me, or call our office, 217-523-4040. Joy, Zach, do you have anything to add about purchasing a separate dental or vision plan?
If you wanted to have an additional plan, I don't know the details of the benefit you were just speaking of, but if it has a benefit of $1,500, you may want to get another plan for if you've burnt up that $1,500 benefit. Now you have option B to go to.
Yeah, in short, we do have other options as well too, but yeah, we can help you go through the details of all of those to see what's going to be most preferred for your specific situation.
Sarah was discussing, she was saying she's seen stories of shakeup/change in Advantage plans. So Sarah, I'll just add to that. Yes, there have been seemingly more and more hospitals and healthcare providers who are dropping Advantage plans. So just so everybody on this call is aware of, SUAA is aware of this. And, one of the things that we are looking to do on legislatively is to find more insurance options for retirees as opposed to just the one-size-fits-all solution currently offered by the state. Getting back to Sarah, when she says she's seen stories of shakeup/change in Advantage plans, she asks, can these disappear? And what's more stable, traditional Medicare or Medicare Advantage?
That's an interesting question.
There's no one right answer. As I mentioned during the slideshow, everyone's individual need is completely different based on your health and your preferences. So there's not one right fit for everyone. That's why it's important to sit down with a specialist to help guide you through the process and see what's best for you individually.
Mm-hmm. Yeah, as when these Advantage plans first came out, they were low in benefits, very, very small networks. And as more and more people have gotten onto them, obviously the funding for them has increased. And so their benefits have gotten better and their networks have expanded. So as to say which is more stable than the other, I'd say that they're both stable, but what is unstable is the benefits that are included with them. And so that is where me and Joy come in, so that way we can walk through what those benefits are every single year, so that way you understand how your plan works.
Pat says, my spouse is covered under me. I turn 65 next year. Can she still be covered under our current insurance? She is under 65.
So usually what happens is maybe a COBRA plan is offered for 18 months to figure out what your next step is, but that is a private choice by the employer.
Eric asks if you can summarize again the difference between trail and trip.
Yeah, so it's pretty much just one is designed for teachers of state universities, and the other is for employees of state universities. So depending on your job position, you will be offered either a trail plan or a trip plan. Benefits are very similar though.
Perhaps maybe we answered one of Kevin's questions earlier, or he just enjoyed the presentation, but he says thank you.
Well, thank you for joining.
Thank you.
So again, I think I got to all the questions. If there was a question that maybe I didn't understand, I was asking that individual member or members to email me directly, thomas@suaa.org, to get you in touch with the right folks. Maybe those right folks will be Joy and Zach. I am not seeing any more questions to ask either in the chat or the Q&A section. So Ada also says, thank you.
Thank you.
I was going to say, Joy, Zach, I know we've gone about an hour. If there's any more questions to our SUA members, please get them in. Laura says, good information as an introduction to Medicare. Thanks. Donna says, thanks for answering all the questions. Eric also says, thanks very much. Joy, Zach, thank you so much for joining us. Do you two have any parting words? Do you want to give out your contact information again? Go over what you all offer at Key Retirement Solutions?
Go ahead, Zach.
Yeah. So again, thanks again for everybody for being on the call. Hope we answered the majority of you guys' questions and cleared some things up. But just remember, Medicare is definitely a specialty of us, but we work in all 4 areas of retirement. That's Medicare, short and long-term care, life insurance, and then rollover options as well too. So feel free to ask us any questions about that. Again, no cost, just to do a free consultation to you and get some good information to you as well too. You can contact me at ZM as in Mary, AA at krs.insure, and can answer any questions via email. Joy?
Yep. My contact is the letter J for Joy, last name Daly, DALY, at krs.insure, or you can contact me directly via phone. I'm a 312-391-6391.
James says, keep doing these, in which case I'll say, just so everybody on the call knows, yes, we do plan on having more webinars with the team at Key Retirement Solutions. We had George and Mickey on a few weeks ago. This is our first time having one with Joy and Zach. Joy was also at our annual meeting. She had a breakout session there with George Holmes of KRS. So we will be, doing more webinars with the team at KRS in the future. So Joy, Zach, thank you so much. That was a very good turnout we had today, by far the best we've had so far. I know Medicare and Medicare Advantage is an important issue for our members, so we appreciate your very informative presentation. Just as a reminder to everybody, we will be sending out their PowerPoint presentation along with a recording of the webinar. So thank you so much to Joy and Zach. Thank you, everyone who attended. And we will let you know when we have our next webinar. I know we'll have one coming up about taxes in November with a Jacob Kubler from Blue Stem out of Champaign, Illinois. So until then, we will talk to you all later. Thanks again, everyone, for attending.
Thank you. Thank you, Mr. Martin.